Welcome back. I've had the pleasure of reading Our Beaches Were Empty, Our Hospitals Full, written by former Honolulu Mayor Kurt Caldwell. Thank you for joining us.
Gina, it's great to be here. It's been a long time, almost 3 years since I last saw you in person. Kind of bittersweet in some ways, but I'm glad we're back together talking about what kept us apart 3 years ago.
Right, and you're mayor turned author now, and this is a book, 25 business, nonprofit, government, education leaders, you name it, coming together to talk about a retrospective on the pandemic.
Correct.
Of course, you can't look back at the pandemic without looking at education.
Yeah.
From that sector, what really jumped out to you about the significance of the pandemic for our kids?
Well, one, Gina, the impact was tremendous on our kids throughout the state of Hawaii, and I think the damage is going to be lasting over a generation, which is really tragic. The other thing, though, I think is equally tragic is the lack of support for the Department of Education in the school system. And that came out loud and clear for the public school system. Private school system, they were on it quickly. They started to do double masking. They did all kinds of things. They got their kids back into school earlier. Well, DOE struggled, not because they didn't have the leadership. They didn't get the support in terms of funding and also the staffing. And then on top of it, they're feeding our youth around the state. It was pretty amazing. I mean, initially, they were just feeding the kids at school. Pretty soon they were feeding the families of the kids who came to school. You covered it, people coming in and getting their lunches. And then there were kids at risk. These are kids just trying to learn and trying to look for social interaction in the most difficult situations. So it was I think all of us, including counties, could do a lot better for our school kids. Even though it's not a county function, education, in a time like this, in a pandemic, in a crisis, once in 100 years, we all should have done a better job.
Some of the most frank and sometimes shocking chapters in the book and segments in the book covered some really astonishing revelations about what Department of Health did or didn't do, in many cases didn't do, during those critical phases. So going forward, you point out that distinction that, hey, in a pandemic, HIEMA, any emergency management agency, is the better agency to control that emergency response. Let the health professionals certainly be health professionals, but you need an emergency expert.
You're absolutely right. And I mean, one of the failures at Department of Health that was very frustrating for us at the City and County of Honolulu was contact tracing. They said we had it covered, we have an army, don't worry, because we're willing to use our CARES money to hire contact tracers. And in fact, we did later on. We actually used polling companies to be contact tracers because they know how to do that kind of thing. But yeah, there are things that they said they got covered that weren't. And it's just that I think they were way out of their league in terms of responding.
So in the book, much of it, meant to be a playbook. You kind of had almost a do-over, or I guess we call it a second half of the game when we had the second wave and the second shutdown. Were you able to employ some lessons learned even that quickly between the first and second waves?
Absolutely. In fact, in the first shutdown, which was in March 23rd of 2020, we shut down immediately, very quickly. And then the pressure was almost, within 2 or 3 weeks, let's start opening up. And what happened? We had this huge spike. So in August of 2020, we had to shut down again. We weren't going to repeat that mistake. And so we thought, how do we do it in a way where your viewers know what actions they make will determine how we open up? And so we created this tier system, first ever, that kind of said, if you're at this level and you see these kind of numbers, these things can open. And if the numbers get bad, you actually have to step back. So we had our medical advisory panel advising us. We followed their recommendations except in one area, and that was restaurants. They said don't open restaurants. And I told them I'm going to do it as the mayor because it's such a significant part of our economy. Billions of dollars in revenue. And I told him I will take the blame if there's a spread.
And it did turn out to work, and maybe that's a lesson for a future pandemic, is you get into this debate of essential versus non-essential business, and for those in support of small business, that if God forbid you have to do it over again, would there be a different approach to the businesses in terms of cutting some off as non-essential versus everyone essential in some way?
That's right. So that's a good question. Initially, I think lockdowns work when you don't have a vaccine. It prevents spread and it reduces mortality rates. I think in the future, if there is another pandemic, that I think initially until you have a vaccine in place, and hopefully it'll be much more quicker now because of RNA vaccines and that kind of thing. But I think initially a lockdown, but more strategic, like you said. Costco was essential, but a small mom and pop store wasn't. And you really were penalizing the local store over the great national chain. And I think there is a way that we could do it better, where if they have protocols in place, we know what they are, better, more spacing, fewer people in the store, so you have timed entry, those kind of things. I think you can be more strategic in the type of lockdown you would do and keep businesses open.
A lot of names in the book, dozens of them, a few that weren't. The current governor, the Speaker of the House, and the Senate President. Can you tell me why?
Yeah, good question. What we did is we interviewed 25 leaders. We actually interviewed more than that. We went to people who actually had to make the decision and stand behind it, good or bad. For example, Governor Ige is interviewed. You know, he got pounded on a lot of things. I think he actually saved many lives. So we didn't interview the lieutenant governor at the time because it's the governor who made these decisions. The lieutenant governor would make advice and suggestions and sometimes criticism, but he wasn't the one standing behind the decision. The same, for example, we interviewed all the mayors, but we didn't go to the managing director of the counties. We interviewed a lot of CEOs, both public and private, but we didn't go to their number twos. I did reach out to Speaker Scott Saiki. I was really hoping he'd say yes. I had his personal cell. I've had it for years. Never returned the calls because he did a good job. You know, he created this panel that COVID POW. It did a lot of great things, and I wanted to hear his perspective because he's the one who ultimately had to make those decisions. And then the Senate President, we did interview him, and at the end, as we were ready to put the book together, he said, "No, Kirk, this is really your book. You know, you're going to be telling your story." I tried to tell the president, this is not my book. It's your voices. Anyone who reads the book, it's not me saying things other than asking questions. It's them telling their stories. And I wish we could have used it because he had some great perspectives. We still have his transcript, and maybe someday he'll let us, you know, use it in other ways. So that's how we made the decision. People at the top of the pyramid who had to make the final decision and be accountable, whether it was a good decision or a bad decision.
And hear directly from them in their own words in this book. And the proceeds from Our Beaches Were Empty, Our Hospitals Full will all go to the John A. Burns School of Medicine. We'll have a link up on our website how you can get a copy if you're interested in reading it as well. Mayor, thank you so much for being with us.
Thank you, Gina. I really appreciate it. And I hope the viewers will buy this book, and it's going to help the John A. Burns School of Medicine, so when we have our next pandemic, they'll even be more prepared to help us respond.